Good afternoon, and it's Friday before another weekend, and I suppose it's going to be warm, at least some of it, some rain I hear. So, I'm not talking about weather forecast, but more to people to continue to be consistent in the distancing and stay within your family households, plan your outings to avoid crowds, and because we still have, as you'll hear some numbers, still quite a bit of activity in the province of Ontario. And while we've opened up some more retailers who are adhering, or we're asked them to adhere to our distancing and curb pickups and proper protection of staff, as well as partitions and barriers, etc., we haven't relaxed any of the social gathering type of numbers, and because we still have to be consistent in that, as you'll hear from the numbers from Dr. Yaffe, we are still waiting to see our numbers improve over the hopefully over the weekend into early next week. So with that introduction, I'm going to hand things over to Dr. Yaffe to talk about today's numbers in that regard. So thank you.
Thank you. Good afternoon, everyone. Today we have a total of 24,628 confirmed cases of COVID-19 reported in Ontario, and this represents an increase of 441 cases, or 1.8% over yesterday's report. Again, 56.6% are female, almost 42% are 60 years of age and older, and 64% roughly are from the Greater Toronto Area. The number of healthcare workers who've tested positive is 4,239, or 17% of the cases. Again, a cumulative number, not representing those currently positive. We continue to see Ontarians recovering from this infection, with 76%, or 18,767 of our cases considered resolved. Currently, 961 people are in hospital with COVID-19. 151 of them are in ICU, and 120 of those are on a ventilator. Tragically, we do continue to see deaths related to COVID-19. To date, 2,021 deaths have been reported, and this represents an increase of 28 deaths from the previous report. With respect to long-term care homes, according to the data in our Public Health Information System, IFIS, we currently have 211 active outbreaks, 4,711 confirmed cases in residents, 1,623 cases in staff, and these are all cumulative numbers. 1,262 deaths reported for residents and 4 deaths for healthcare workers. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, 54 retirement homes are in outbreak, with 186 deaths reported. With respect to laboratory testing, Ontario, we have completed a total of 588,958 tests. In the last 24 hours, 11,276 tests were completed, and 5,516 tests are currently under investigation. So those are the numbers for today. I'll turn it back to Dr. Williams.
Okay, well, thank you. And so the key aspect there is that we have some increased testing, as we usually do. Following the week, we increase up to tomorrow, and then sometimes we have a weekend dip. We're hoping to offset that with our announcement that the assessment centers locations are going to be put on our web and can be accessed through different tools and methods. And there's going to be a phone number that you can call ahead, that if you have any symptoms compatible with COVID-19, you can call and to make an appointment. We would like the appointment rather than just whole crowds come again and trying to look at our social distancing. So we don't want assessment centers to become in violation of our physical distancing in that regard, and to have it in a coordinated civil way of handling people in a timely fashion, so you wouldn't have to wait too long either. So we want you to check on that. And as the Premier is hoping that people who are symptomatic with those symptoms and that would avail themselves to come out to the assessment centers to obtain the testing and to utilize our lab testing capacity in that regard, and continue to assess our public to see what kind of ongoing incidence and prevalence of COVID-19 is in our community. So with that, we hope maybe the numbers will be up over the weekend, but that of course means that people will have to come forward, and some had concerns. I would assure you that the staff are well trained, they're well equipped, and as I said, they're going to run them in an orderly way so that there's no crowding and so no risk of obtaining infection while you go to those centers. So some people were apprehensive, and we want to reassure you that that is not the case. In the assessment centers of our 127 and 129 at times assessment centers, about 25% do a large part of the testing and assessments in that case. They tend to be those, as suspected, in the greater Toronto area, larger centers such as Ottawa, Niagara area, Hamilton, etc., and Kitchener, Waterloo. They tend to be some of the more busier locations, and the larger ones tend to be in Toronto, Peel, and York region in that regard. So we're going to continue to monitor that situation as we move through our first few days, since on Tuesday the 19th, of step one of phase two, and to be looking at how we are our public health measures table to assess how the go forward is and to assess the overall response of our ongoing public health measures in that regard. We are still asking those measures be kept in place, as I noted already at the outset. And of course, we have asked that people wear facial coverings, non-medical, sometimes called masks, in that regard, and they would do so in settings where they know there's a good chance they would not be able to maintain that 6 foot distance, and you would do that for protecting and to notify others that you're being respectful of their space as well in that regard. So those are most the main highlights for today in that regard. And so with that, I'm going to hand over to the media for questions.
Okay, we'll move to the phone line for questions.
First question comes from Allison Jones from the Canadian Press. Please go ahead.
Oh, hi, doctors. The Premier said today in his briefing that you, Dr. Williams, will be issuing a directive for expanded testing starting over the weekend, doing asymptomatic frontline healthcare workers, as well as a second round in long-term care homes and seniors' homes, which I think may mean retirement homes, but I'm not sure. Is there any other details you can provide us about that new directive?
So just to correct probably on the terminology there, that there would be from our command table and from our testing strategic table, the leads on that, we have different individuals such as Mr. Matt Anderson, who's the CEO of Ontario Health, who runs the logistics of the testing as well as the hospital centers, and then Dr. Dirk Heyer, who we're boring over from his role for a little bit as our Ontario Chief Coroner, is helping to coordinate that as well. So we had discussed about sending memos out to the field in regards to enhanced testing of asymptomatic individuals in different work locations, such as repeat testing of staff in long-term care facilities, retirement homes, as well as in some of the acute care hospitals. So it wasn't a directive, as we speak of legally, from my table. Those are different concept, but the same terminology, same ideas there, that a memo giving direction to these facilities that was coming out from the table, the command table, and under the auspices of the CEO of Ontario Health, as well as from the, as I said, from the command table under the leadership of our Deputy Minister, reporting to the Minister of Health. So that will be coming out this weekend as they start to ramp up those other types of testing, along with ramping up the testing at the assessment centers, with the public being encouraged to come forward if you have symptoms in the wide array of symptoms that are noted on our web pages compatible with COVID-19.
Follow up?
So then are public health officials being told to do in retirement homes and acute care hospitals what has already been done in long-term care facilities, which is, going in and testing every single person, whether symptomatic or not?
So Public Health coordinated the long-term care survey. A lot of the testing was mostly done through assessment center staff anyways, which is under Ontario Health, and through sometimes use of paramedics in assisting in that role. so that the testing again will be rendered by either assessment center staff, other staff that would be recruited and brought into place by Ontario Health in that regard. Public health in per se are focusing on case contact management, outbreak management, and of course, if there's outbreaks in those institutions, public health would be coordinating the testing of not only some staff, but all the staff and all the residents if there's another outbreak declared in any of those facilities there, except hospitals. And hospitals, when they have outbreaks, that's fully within the authority and responsibility under the Ontario Hospitals Act for the hospital and its board to undertake their own surveillance and management of outbreaks in their respective hospitals and institutions. So just a bit of clarity of roles and responsibility there. So from our testing strategy table, individuals and groups will be recruited to bring forward doing the testing in these various centers at different times, ensuring that the assessment centers can still do their job. So there's a little bit of balancing here depending on how much load each one gets, and that's still being worked out in the design over the weekend.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Go ahead.
Hello, Doctor. I just wanted to check a bit following up on Allison. Do you have any more details on what the Premier announced next week for testing? He's talking about testing truckers and other people with occupational risks. I'm a bit confused by all this because when I asked about this last week, you guys were saying that it's not a priority. Now it's a priority. What changed? Is it political pressure? Is it a change of strategy? Is it science? What is it?
So last week, of course, we were concerned about our capacity. We got close to near the end of our survey, up to 19,000 tests, reaching close to our capacity of the 20,000. And we had announced the opening up of some wider testing at our assessment centers. And over the long weekend, we're unsure if we would surpass that capacity. That did not occur. So it became very much aware to the government and to the Premier, of course, that we should be utilizing that capacity. And it's had many requests from different sectors, including some of the ones that you quoted there, where they have wanted to have some assessment of their staff who may be asymptomatic, or from some other workplaces that people returning, would they be able to access testing for their employees and other survey methods so that when the capacity is now available, that's why the Premier was saying, well, we need to utilize that to the best we can to assess the overall aspect of the population, including workplaces that he's very much concerned about, and have them go forward. So that's under the auspices of the testing strategy group. Meanwhile, the others have to do their job. Public health has to continue doing case contact management, outbreak management, and the others have to do the ongoing work of assessing the public through assessment sites, and we've looked at perhaps even using mobile type units to allow public who are symptomatic or of concerns to get seen. So there's lots of things on the table to make sure that we can utilize our testing capacity at this time in strategic ways, and that's what the strategic testing table, the testing strategic table, is undertaking at this time.
Follow up?
Okay, thank you for that explanation. Just to go into the numbers a bit today, we had another increase in the numbers. I know you said previously that it might be nursing homes people, but I had a call from a veteran family physician today who said that even though the numbers are going down in the testing, with the higher cases, he is actually getting contacted by more of his patients who are just more or less random people in the community who are testing positive. So do you see any trends, and do you see any hotspots?
Yeah.
Sure. Well, first of all, I mean, it is concerning that the numbers are going up. So we're definitely monitoring very closely and looking at potential hotspots. And as Dr. Williams said, public health, that is the main focus, doing the case investigation and the contact follow-up. Almost 64% of the cases are in the Greater Toronto area, and particularly Toronto and Peel, somewhat in York and Durham. So as well as Ottawa and Windsor with the cross-border traffic, so on. So certainly that is, we are working closely with those, particularly those health units, and looking at geospatial distribution of the cases, trying to identify if there is no obvious contact, whether there are some common places that people might have been, looking at social network analysis and things like that. So those are the kinds of things we're looking at, in addition to obviously encouraging people with the symptoms to get tested, because we need to get as complete a picture as we can of where this infection is occurring.
Next question.
Next question comes from Jessica Smith from Queen's Park Briefing. Please go ahead.
Thank you. Hi, doctors. I'm wondering if you could give us any numbers for how many of the tests are coming from the public at assessment centers. And if you have those numbers, have more people been going to assessment centers since you opened up the testing criteria a week ago?
So that's a good question. We have been looking at our data, and we have a breakdown from all the different assessment centers in there. Thus far, since we put out the notice on the weekend, and we've been made aware that sometimes our messaging from our various sources, be it the self-assessment tool or from telehealth, has been less than consistent to direct the public in that regard. So we're hoping to do we're planning to clarify that and to do some more public messaging so that the public are not only kept consistently informed, but are given the information they need to access those centers where they are and how to do so in an orderly manner. So the numbers had not gone up. They always dip on the weekend anyways, and they haven't gone up any higher than other weeks as before. So we're hoping that that would increase considerably over the next number of days with people, assuming that people have symptoms, as the previous reporter asked, that said heard some physicians had noted some of their clients were coming forward with more concerns and issues in the last number of days. So we want to assess that. And as Dr. Yaffe said, especially in our greater Toronto area where the majority of our new cases seem to be arising. And again, we're trying to understand where that's occurring, as Dr. Yaffe said, and to better assess the, I guess, clusters and grouping of that if we can, and to focus testing and encourage testing in those specific areas.
Follow-up?
Yeah, so I was wondering if you could expand on the hotspots, the GTA is a very large area. Do you have sort of a neighborhood idea of the hotspots, and will you inform people at some point where those hotspots are so that they can know that they're living in one or not?
Well, I think, again, we've been working with the local health departments and looking at the geospatial analysis of where those cases are. And so one of the options that's being considered is a mobile testing bus, something like that. And obviously that would focus in on areas that are more concerned, and they would be working with the local community and market and ensuring that people know where the testing is happening. So that's something that's under consideration.
Next question.
Next question comes from Randy Raff from Sage TV. Please go ahead.
Yeah, hi, doctors. I'm wondering about this study or this article that was in the National Post today that was written by a couple of respiratory disease experts from McMaster and the University of Toronto, where they're saying that we should base opening up society, opening up the economy on hospital capacity as opposed to the number of cases, and that we should more strenuously try to protect those in our society that are vulnerable. What do you make of that?
I had a glance at the abstract of the article. I think it's, my sense, I'm not sure whether all infectious disease consultants would agree. And certainly our experts that are at our table have a perspective that case contact management and containment, since a lot of the cases are, it's only 6% hospitalization rate in there. And if you let it go in that sense of saying, let it go population-wide and only back down when your hospital is compromised and overloaded, we have said that's not a good way. We don't want to have that happen. We've tried to keep our capacity open in our hospitals. That's why we limited elective surgery. We acquired more ventilators because we did not want to be in a situation like Italy and some of the days in New York City where our system was overwhelmed and we couldn't cope and handle that. So I don't think letting things go out until your system's overwhelmed is a good idea. But I do think maybe they meant more of monitoring that, and we are and have continued to monitor that with our daily data. So we watch the hospitalizations, we watch the number of COVID patients, the number in ICU, the number on ventilators, and our other numbers. So we just don't use one metric, we use many metrics in there to look at how it is, because the epidemiology of COVID-19, we're understanding more as it goes along, and looking at this whole aspect of pre-symptomatic or sometimes asymptomatic case transmission and its various presentations in different demographics. So I think I would be cautious about just using one indicator such as hospital capacity to lay out your public health measures and directions for containing and controlling COVID-19 in the population writ large.
Follow up?
Okay, thank you. And my next question is, there seems to be a serious problem in getting enough people in to be tested, particularly asymptomatic people. Do you foresee a point where you will have to order people to be tested, the general public I'm talking about?
Would you try there?
Oh, yeah, I think that's quite unlikely. Right now, we're really trying to encourage people with any symptoms to get tested. And if there's a situation where there's a case and we're doing follow-up with contacts, or in an outbreak situation, that's where testing becomes extremely important. And if necessary for outbreak control, the local medical officer of health may decide an order is required. But that's a last resort. So an asymptomatic testing, again, the testing that public health just coordinated in all the long-term care facilities for staff and residents, the testing was strongly encouraged. It was not mandatory. And we had excellent response rates. So I don't think mandatory testing is something that we would be looking at.
Next question.
Next question comes from Emma McIntosh, National Observer. Please go ahead.
Hi, doctors. Thank you for taking my question. I'm just looking at the bump this week. I guess I'm curious to see if there's anything that would explain it. I know it's too soon for all these new cases to reflect the reopen that happened Tuesday, but I wondered if there was any chance they might be connected to Mother's Day. I did see a lot of people bending the rules a little bit that weekend. I wonder what you thought.
So the little surge we're seeing at the moment in there, I've asked some of the health units on that. Some are still entering, because remember, this is based on our IFAS, that's the Integrated Public Health Information System data entry, and some of those are the late residual cases from the survey, still going through with long-term care, added to some more localized cases. So well, Mother's Day, it was a weekend, and it was some sunny weather in there and some aspects. I haven't heard that one ascribed in particular. I've heard that some people may have been more casual on the last couple of weekends than we would have liked, and so we're still encouraging that physical distancing in that regard there. But no, I haven't heard anything in regard to Mother's Day, and I think we want to watch these numbers over the next few days to see, is it the residual of the surveillance added to some more public testing in that regard, or is it going to be consistent change? So our experts, including our public health measures table, are watching this and other metrics to see the explanation and breakdown there, because on the data we see here, we still have a fairly good number and percent of the cases, even up to yesterday before, are from long-term care and close contact data being reported into the IFAS system at this time. So that residual effect, as I said earlier in the week, might continue well into this week, and that seems to be the case. So we'll have to see once we get out of that totally, and then we go into the next surveillance as announced or asked by earlier reporters in regards to other settings. So it's a vibrant, changing situation, and there's lots to look at and monitor in this regard.
Follow up?
Thank you. So one other thing I was wondering about is, given all the problems that have happened since March with the testing program and all the snags, is there anything you wish you'd done differently early on?
I guess our wish all the time from early on is that we had unlimited lab equipment, unlimited reagents, and unlimited swaths, and unlimited PPE. Everybody in the world wishes for that. And that's the problem when you have a true pandemic. Everybody's competing for the same scarce resources. So, yes, I would have liked to have that available, but we have to work with what we've got and to deal with it. And I think we've done that in a fine balance the best way we can. We're not through that yet. We still have a number of areas that our overall command table is really being challenged with, as every other jurisdiction in Canada is struggling with, our federal counterparts, and most of the world as well. So we're continuing to work on that and to take all the steps we need to ensure as much as possible the ongoing health and safety as the Premier desires for Ontarians.
Okay, we're going to move to the last reporter on the line.
Last question comes from Snea Dougal from Queen's Park Briefing. Please go ahead.
Hi, doctors. Thanks so much for taking our questions. I wanted to ask you about the planned resumption of scheduled surgeries and procedures, as that was listed as being part of stage one. I know hospitals are currently working to develop plans in order to meet the criteria that was set out by the government, but we were also told that before they can resume those surgeries, Directive 2 has to be revoked or amended. And as I understand it, that directive is still in place. So I'm just wondering if you could speak to why that is and what the discussions or what discussions are happening right now just around that.
And that's a good question. As we have looked at that, now that we have gone over the hump and in the intensive care usage and the capacity, and we want to utilize that, there's been a lot of discussion, certainly within our ministry with the division that looks after hospital services. Ontario Health has been reviewing that matter intensely, looking at the various differences throughout the province, the different facilities. As you know, some of the facilities have been utilized to hold some long-term care residents who their places are in outbreak, and so they have to look at some dynamics. So it's not in isolation. There's a lot of movement here, and already a number of surgeries that were seen as less than essential have been moved up already. So there's a lot of shifting happening. So in the final rendition of the revoking, rolling back, modification, amending the directive, in that, even though it's under the directive powers of the CMOH, it's directed and worked through by our command table, which is certainly looking at all the different components to ensure, as even like when you talk about, the Premier talks about a well-orchestrated return to normal function. It's even more critical in the hospital sector, utilizing those resources, whether it's operating procedures, ICUs, and other backup services, so it is in a way that is timely and reasonable, so you don't overtax your system. At the same time, those that are essential and critical should get done first, and there's a whole pecking order in consultation with the many different experts, specialists, and leaders of the hospitals to undertake that task. So it may seem easy just to roll it back, but as the Premier said, even rolling back is harder than closing down, and that's true in the case of Directive 2 and the surgeries. So that is a robust discussion, and we hope to have that resolved and those steps taken forward in a process that they're mapping out at this time. So it needs to be addressed and addressed quickly, and they're working at that as quickly as they can, with adequate consultation with the leadership in the various facilities and with the consultants.
Follow up, and this is the last question.
Okay, thank you. And so do you have any sort of an estimate on timeline, both for the directive and perhaps when you think, obviously it's going to be very different across the province, but when you think some hospitals might actually be ready to start resuming those kinds of procedures?
My only answer is soon. I've seen many final versions that have been pulled back as other sectors waited and said, not good enough, we've got to amend this and amend that. So it's to get all that together. I know that we want to do it fairly quickly, and I know our ministry does, and minister, to get those necessary surgeries back up and get any backlog handled, and especially a hierarchy of less urgent, more urgent, very urgent, and different ways to bring them back into line there and to utilize the resources as best as possible, because there is a backlog and it will take a while to get caught up. So you can't just suddenly bring it back up and do everything at one stage. It has to be phased, and all those things are brought into consideration. So I would like it soon in that sense. And again, that's mostly in the auspices of Ontario Health and the hospital division of the Ministry of Health and Long-Term Ministry of Health, sorry, at this time.
Thanks, everyone. Have a great weekend.